And now to another big story. The spread and concern over the Zika virus continues to capture international attention, and now health officials say a patient in Texas did not contract the virus from a mosquito, but from another person. Officials say the patient got that virus from sexual contact with someone who recently returned from Venezuela and fell ill. This is raising more concerns about containing the virus that health experts say may cause birth defects in newborns. Our senior managing editor at FoxNewsHealth.com and a member of the medical A-team, Dr. Manny Alvarez, joins us now to discuss this. It's close to home for both of us. I'm 31 weeks pregnant, and you deliver babies professionally. So this is something that really I'm sure you're talking about with your patients. Before we dig into some of the new news on this, what are you telling your patients about this?
Well, right now, I'm telling my patients, they're asking especially about traveling to the Caribbean and South America. I'm suggesting that they don't do it because there's a lot of unknowns. I'm very concerned about, we know that this is an endemic problem in South America mostly and in the Caribbean. The problem that I have is that those health departments in those countries don't really have good accountability what their regional problems are. A country like Venezuela, there's a lot of reporting cases, but again, the health department is not really, they don't have the handle on it. We have better data in Brazil, 4,000 cases of microcephalic infants born, which is a huge amount. They have some national campaigns of fumigation because the only way to eradicate this problem short term is to eradicate the mosquito. But there's no handle. So this is why the WHO is saying we're looking at a global public health crisis.
Let's talk about the birth defect for a moment, because that certainly is one of the most alarming aspects of all of this, microcephaly in the infants. But it can be caused by many things. And right now there's a presumed link, but it's not scientifically proven yet. Tell us a little bit about that concern.
Well, microcephaly is a condition that you have a small cranium, a small brain. This is diagnosed with ultrasound usually in the second, third trimester. And we know that there's a genetic component. There's some genetic diseases that could lead to microcephaly. But we also know that a big culprit is infectious disease. And there are many infectious disease, toxoplasmosis, for instance, CMV, that can get through the placenta into the fetus, especially in the early stages of pregnancy, and can cause brain damage. So we have pretty good evidence that the Zika virus is the culprit. The mechanisms are going to be forthcoming. Exactly what gestational age do you need to be pregnant in order for the Zika virus to affect? Of course, the common sense for an OBGYN is to say, if you get the infection early in your first or second trimester, because this is where the baby is developing, versus, in the third trimester, that, you don't develop microcephaly in the third trimester. So we know a lot about
What's the treatment for that, for a child that's born with that disorder?
Well, there's really no treatment per se. You have, congenital deficiencies of the brain matter in conjunction with the bone structure of the child, and a lot of these kids do have, learning disabilities, motor disabilities of the sort.
How concerned are you about the latest headline? Again, we knew about this anecdotally. There was thinking of that this could be transmitted through sexual contact, but now this is a recent case. How big of a deal is this?
I think it's a big deal, but still I think the big problem is the mosquitoes, because that's the natural vector for the virus. But clearly these anecdotal reports that we had in the literature going back several decades are true, and this is a perfect example. So this is going to change also the dynamic, not only in those areas that are super infected with the virus, eradicating the mosquitoes, but also bring a public awareness that you can get it through intercourse, so you have to get protection for that too. So this is a big public health crisis that we're going through.
Certainly something we're going to continue to watch. Dr. Manny, thank you.
Thank you.
John?